The Skull Osteology section of the Tooth Atlas is an important section because it puts the teeth into the context of where they are. So let's take a look at that now. There's three different sets of models in here. The first I want to look at is what we call the Stanford skull. And basically what this is a series of photographs of a skull and x-rays of the same skull that you can rotate around and see how the skull looks in relationship to an x-ray of that part of the skull. So let's look at it in position, and now we can morph this into a radiograph. And while it's in that position, we can go ahead and go through the whole circle of it. There's high resolution sections in here that if you're trying to find images for lectures that you can load up, and this will give you highly detailed photographs of a beautifully dissected skull showing the root structure and the nerve location, etc. Another important section of this is the 3D models. We'll go to the 3D models now, and you can see there's a number of different choices here. Full skull, a child skull, a newborn skull. One of the models that's the most interesting to me and the one I use the most clinically is the maxillary model. And this is a very high resolution, three-dimensional model taken off of a CAT scan, research-grade CAT scan. And then we artificially rendered the nerves and the arteries. So we can actually take these nerves and arteries and make them go away, which we'll do right now. So we'll take the arteries and make those transparent. We'll take the nerves, make those transparent. One of the things I find fascinating about this is that if a patient comes in with a complaint of having pain in their upper teeth and you don't find a dental cause for it, there's a probability that it is a maxillary sinusitis. And if we look at the relationship of the teeth to the maxillary bone, you can see that these teeth are sitting right on the floor of the sinus. And this is a really good illustration to show the patient why their teeth hurt when in fact what they've got is a sinusitis. The mandibular model also is interesting. It shows the distribution of the inferior alveolar nerve and the mental nerve as well as the lingual nerve. You can see the relationship of the mental nerve to the inferior alveolar nerve and then the roots of the teeth. This model is also unusual in the fact that the lower first molar has three roots. You'll notice right in this area, distal and a distal lingual. We'll rotate this around. You can see it from the other side. This is a fairly unusual finding for a lower first molar. The first premolar also has two canals in it. The roots are fused, but it has two canals in it. That's also somewhat unusual. That is the skull section of Tooth Atlas Hygiene version 6.0.